they're 0 to 2, sometimes, and it's their first visit, we have this appointment called a happy visit. I give them the mirror, and we try and take photos with an intraoral camera. And it's so cute because like the first picture on their file is a picture of their thumb.
Aww.
Welcome back to another episode of the Tooth or Dare podcast, peeps, with your peep Irene and your peep Vic.
Hey!
Op talk.
Op talk, op talk, op talk.
Oh my God.
We'll probably cut that out.
Yeah, let's edit that in. We're here to answer some DMs. We're here. It's the DM time.
It is.
Da-da-da-da.
All the juicy questions.
Some of them. First question is about timing. And it honestly is one of the most asked questions among all social media content creators. I think I see this come up on Brit's page, on Whitney's page, on Amber's page, on Hadir's page, and then we're answering these questions in our stories, but we're not posting it somewhere. So
elaborating.
I think I answered the question already in the post, but let's dive a little bit.
Yeah.
At first.
So the question.
Empty swimming pool.
Yeah.
What was the question? Read us the question.
How long are your appointments? I know each patient has different needs and they may change. Unfortunately, a lot of us work in offices where most of the time the appointments are between 1 hour to 1 hour and 20 minutes. How do you calculate the time you need for that specific patient?
Got it.
How often do you change your instruments and what sharpening stone do you use?
Okay.
That was the full question.
Lots of extensions on this question. Let's do the easy ones first. Yeah. Changing of the instruments. Manufacturers recommend anywhere between 12 to 18 months. Each instrument has its own kind of life cycle. So 12 to 18 months. But if you're using the same kit over and over and over again, then obviously you're going to be closer to the 12 or even fewer or even less. So we have 9 operational standard kits. So there's 3 different types of kits that I have. An SRP kit that are very specific for sites. And we'll talk about an SRP appointment, what that looks like. But we have 4 of those kits because we don't always need to use them. And then I also have loose minis and rigids. I don't have loose rigids. I have loose minis, like an 11, 12, 13, 14 coupled together or a 1, 2 coupled together. And then I can kind of tell where a vertical pocket is. And if I need a whole kit for it or just one, and those are pouched. And then we've got 9 operational standards, which have a 6, 7 or a Nevi of some kind, an 11, 12, 13, 14, 7, 8, 1, 2, 204S, and a universal, either a 2R, 2L or a 4R, 4L. So we have 9 of those, and there's 2 full-time hygiene running. So we go through those quite frequently.
Very fast.
I'd say that I order instruments whenever there's a trade show deal. So oftentimes ODA, the Ontario Dental Association meeting, which is in May, I'll place an order then and they'll roll in, and then usually the end of the year. So we just replaced a bunch of instruments in December, which leads into the sharpening question. I have Diamond Sharp come to the office once a year at the end of the year. And I think one of my biggest flexes is that on day 1, January 1st, or whatever the first day is, when we all come back to work, all of our instruments are sharp.
Lovely feeling.
And
so great.
We didn't even have to do it. It's the best.
It's like Christmas all over again.
So I messaged Summer. She came in on a Thursday at 7 a.m. here. They lined up all the instruments on the counter behind me. And she came in and she does this thing where she'll sharpen them and then they go into their next life cycle. So they go out of a kit into a pouch and then out of a pouch into the recycling. It doesn't make it into a box somewhere where your operatory.
Yeah.
So it's either a useful instrument or it's time to recycle them because we just end up having too many. And then when we do our own maintenance sharpening, we use the sidekick sharpener, the Hufredi sidekick sharpener. And then the diamond sharpening cards have been our new favorites. We used to use the standard stone, but I find that I get a finer sharpen with the diamond cards, specifically the fine one. And then the tips or toes use the little white stone. Bada bing, bada boom. That's it.
That's
the sharpening. It's the sharpening one. So that's the replacement of them kind of twice a year. But We're not doing like a full replace
No,
because
yeah.
some instruments use more than others.
Yep.
What's your favorite scaler
And my favorite scaler
of all time? If you had 3 scalers, if
Ooh.
someone said to you, you're working in this office and you have 3 scalers and that's all.
S204S.
Okay. Posterior sickle. Got it.
Might be unpopular opinion, but I really like the YG78. Some people, they either hate it or love it.
Okay.
Yeah, I
Tell
do
me
like
why.
it. Because it's so universal.
Okay.
And it's great for stain. Amazing for stain. So if you work in an office where you don't have like a Profi jet or an airflow or anything like that, it's amazing for stain. And I did work in some offices like that.
You have one left.
Pardon?
You have one left.
Yeah, I have one left. I know. I think I like Montana Jack too.
Okay.
Yeah, I think those ones.
What's the number of that one? 13, 14, 15?
No.
16, 17?
I don't remember what the number
18,
is.
19, 20, 21.
Yeah, I don't remember. But
there are 2 types of dental hygienists in the world. The ones that use the numbers like me and the ones that use the names like you.
Yeah, I know.
I may have already said what a Montana, like, it might already be a 13, 14. What is a Montana?
I don't know.
I'm Googling
Get it up.
Who makes it?
I want to say PD.
PDT?
PDT, yeah.
Montana Jack instrument. Search. Made by PDT. It is an R183, 138. Dyslexia just happened. You just witnessed dyslexia firsthand. Okay, and it looks like an H6, H7s or a Nevi.
Yeah, it's like curved a little bit.
And it's curved.
Yeah.
Got it.
Yeah.
Okay. All right. So you're an posterior sickle, anterior sickle kind of gal.
And a YG.
And what's that one?
A YG78.
Oh, a 7/8. YG 7/8. Hold on. Let me look at that sounds like a young instrument.
It is.
YG 7/8. Obviously, you can tell that Vic is not very particular to keeping the instruments of the same manufacturer.
No.
She's like, I have one Hygiene instrument, one PDT instrument, and then one. Okay, so
Hygiene makes that one too, I think.
Yeah. So it looks like a 7/8.
Yeah.
So it's like a posterior line angle to line angle.
You can use it in the anterior too, but yeah.
Cool.
Like on the dips, like the anterior
Yeah.
buckles and linguals. Yeah. Those, it works really good.
See, there's a Nevi that I like that has like a little scoop.
Oh yeah.
We're totally off topic. This
anyway,
is how an episode goes from 15 minutes to 25. And our Nicole's just looking, she's just like, okay, so sharpening
done.
instruments, done.
How long are your appointments?
Good question. So let's break down the different types of appointments because everyone in their computer usually has like a preset appointment type and they're color coded. And so new patient. Let's start with new patient. There's 3 different types of new patient appointments. And we just had an office meeting on Thursday where we talked about appointment types and timing. And someone said, like one of our receptionists was like, should we be scheduling longer appointments when we're on the phone with someone and they say, well, I haven't been there in a long time? Yeah. And my immediate answer was no, because what if they cancel? And this is like the business hat of mine that goes on is like, I don't want a 2-hour open chair time in hygiene because some new patient that hasn't been to the dentist in 30 years got cold feet that morning. Yep. So I said, no, like adult new patient appointments are 70 minutes for both hygiene and the doctor. If someone calls and they say they haven't been in that long, then I don't want them to give them more time. I want them to encourage that the dentist sees them first. Right. That x-rays are taken or they're imported. But if someone hasn't been in that long, then they don't have updated x-rays. So then that way, like I have all of the tools that I need before the patient even arrives.
Prepared.
Right. I can treatment plan. So 70 minutes for new patient adults. For pedo, so 0 to like 6, usually we do 30 to 40 minutes. If they're 0 to 2, sometimes, and it's their first visit, we have this appointment called a happy visit. And it's a purple appointment in our schedule. It's 30 minutes. And most of the time I'm just reading them a book, doing a magic trick, doing a tattoo, and like we ride the magic chair. I show them the mirror. I give them the mirror. And we try and take photos with an intraoral camera. And it's so cute because like the first picture on their file is a picture of their thumb. Because we try and show them the camera. So like I opened up this photo of this like little, like the Sodexis for the kid. And there's like Dr. Michelle and I were doing the morning audit and like you see a thumb photo and you're like, that was their first picture.
Oh, it's so cute.
That's the happy visit, 30 minutes. And then anything like over the age of 6 until about like 13, then it's 50 minutes. And then after that, they turn into an adult. Like I know they're still a teenager, but like a 14-year-old's mouth.
I agree.
Dumpster.
Yeah.
Sometimes.
Arguably, sometimes worse than adult.
Worse.
Because
and then they're in like, sometimes they're mixed incision, sometimes they're in ortho. So those are the new patient appointments. And then SRP appointments are typically an hour and a half to 2 hours, depending on what I'm doing. And we'll do an SRP podcast, op talk. If
to
not
follow
this month, next month, to follow. But those are 1.5 to 2 hours times 2. Right side, left side, with or without local. And then 3 to 4 month maintenance appointments or 4 to 5 month maintenance appointments. Those are 50 minutes. And recall appointments, which are every 6 or 9 months, are an hour, 60 minutes.
Awesome.
But that's just what the computer says.
Exactly.
And oftentimes we will add a pop-up and say like for example, I have a 3-month maintenance appointment patient who is arguably the kindest human. And I know she means well, but she'll never do what I tell her to do.
Yeah. Some patients won't.
And I can't even be mad at her because she's so sweet. And she's like, I know, Irene, I'm sorry. And she apologizes. She'll do better. And like, I believe her every time. Like she's totally gaslighting me every single 3 months. So I have a pop-up and I'm like, every appointment with her needs to be 1 hour.
Yeah.
Even if it's a maintenance appointment, and an hour and 10 if we're doing full mouth probe, x-rays, or a recall. Now, I very luckily have an assistant, so I don't take my own x-rays often. For whatever reason, I might if I need to, but like they seat my patients for me and take my radiographs and flip my room.
Awesome.
Yeah.
So going back to your recall, because I'm sure there'll be a lot of questions about this. In that hour, what does that typical hour look like?
Yeah. Every patient gets a extraoral intraoral exam right at the beginning. So review medical, so patient seated. My assistant seats the patient. My assistant takes blood pressure, updates medical history, like reviews, but asks the question if there's any changes, documents that into the chart note. So my assistant will start my chart note for me. And then sends me a yappy message and says, patient's ready for you, updates me if there's anything that's done. And then I jump in and I talk, a little bit of like, how are you? How's the kids? What's the happy new year, new you, all of that fun stuff. And then I go into like treatment planning, like I've already read my notes in the morning because we do like a pretty comprehensive morning huddle sheet review. And so I kind of know, like, what did I say that I was going to do last time? What am I keeping an eye on? Am I doing a full mouth probe or am I doing a PSR? So I get the consent from the patient. I'm like, so the plan for today is we're going to do A, B, C, D, E, X, Y, Z. Sounds good. Great. They say yes. I say yes. And then we start with an extraoral intraoral exam, oral cancer screening. And then I jump into like Optrogate, disclosing agent. I start my oral hygiene instruction at the beginning of the appointment, take intraoral photos with my intraoral camera. When they lay in the chair, you can actually see the chair behind me, but when they lay in the chair and they hold their mirror, they can either hold it to look in their mouths or they can actually look at the reflection of the screen behind me. So sometimes I will have them like in direct vision, look at their photos, and we're kind of like talking through things. And then I'm very silent when I work.
Yeah.
I don't talk at all.
Me either. Yeah, me either. I'll talk before and after. Maybe a few things in between if I need to, but that's it. Yeah.
I'm just like thinking about how I'm going to deliver the bad news at the end, the entire appointment.
Just a little bit of bleeding.
If I say a little bit at all in 2025, I'm retiring. The end. It's just a little cavity, just a little bit of, you've just a little bit of periodontal disease. Your teeth are just a little bit loose.
Anyway, topic for another day.
So that's that. So yeah, intraoral, extraoral, debridement, and then the conclusive part where I've I'm seating them up. I take out the Optragate. I send a message in, like I broadcast a message, like ready for doc in op 3, stop 3. And then I do my spiel. Like doc comes in, this is what we did, this is what I saw, and then she does her recall. She also does an extraoral intraoral exam, which I love.
Yeah.
And sometimes if I forget or if we're running late or like whatever it is that's happening, she'll ask me in front of the patient, and it's like, yes, like hold me accountable.
Yeah.
Most people don't hold the boss accountable. No. So she's like, did you do an extraoral intraoral exam? And I'm like, actually, I did. I palpated the lymph nodes, and there was no lymphadenopathy here, and the macule and the.
That's awesome.
Yeah. We use like, I have like some sheets. I'm going to link this all below. If you don't already have them, you have them. Grab all of the laminated sheets, Vic. Oh, the one. There's more. So because sometimes, so often for new patients, and we'll talk about new patients, my assistant helps me document, but I have all of these laminated sheets with things like verbiage. For example, the oral cancer screening one. This one has the description of all of the lesions. So if I'm saying a bunch of stuff out loud to my assistant, and then the patient's looking at me like, what did she just say? Oh my God, do I have cancer? I say things like, you might hear me say something like macule, which is just a really fancy word for freckle. So I will show them this sheet of like what a freckle looks like, what a papule, what a macule, nodule, wheal, whatever. So we use all of these like laminated sheets.
That's awesome.
Yeah. The same thing for blood pressure. Like when she's taking blood pressure and they're like, well, what do I have to take blood pressure for? We follow like the CDHO, the College of Dental Hygienists of Ontario standards of practice. And they have this like this sheet from red to yellow to green that tells you what you should do next. So if a patient comes in and their blood pressure is elevated out of the green for whatever reason, which is 130/85, then like she'll pull this out and keep it chair side and say to the patient, okay, well, we need to, 1, recheck your blood pressure after 5 minutes. Like, do you need to use the restroom? Did you smoke before you came in?
So did you run here?
Yeah. Did you run here? Are you anxious? Are you nervous? Like we have all of these things like in front of them so that they don't wonder, well, why?
Mm-hmm.
Why are you doing this?
Yeah. It's a great resource.
Yeah. Same thing for like SRP and perio. After I've probed, I pull this out and I show them like, this is where you are. So I'll link this below. And they're free. Like I don't charge anybody for them. You can modify them and copy them and do whatever you want with them.
Yeah.
Yeah.
Awesome. All right.
Did I answer that?
You did.
Did I miss anything?
Nope. That was everything.
Cool.
Yeah.
All right. That's it. Now, if you want to ask questions that perhaps may turn into an episode like this, or if you want any of these downloadable resources, Vic, where can our friends at home or in the car or at work find them?
You can go to @Toothlife.Irene on Instagram, and there are 3 pinned posts.
The first one is where Irene will be speaking this year. The second one is the resources post where you can comment and we will send you a link to the downloadable resource. And the third one is the clinical questions post. You can comment on there and we will answer any questions you have.
You can also download them from my Toothlife website. They're all at toothlife.ca. And you can hit the resources button there and download all of them. They are free. And if you want some other resources, you can also comment in there as well. And then we create resources based on what people's needs are. And if you send me a DM, I will kindly ask you to put it in that post. I know some of them are a little personal and you don't want to like call out your office. Like we get it. We can be very tongue to cheek in the way that we respond to things, and we'll never use your names.
No.
So, I will always say like, comment there because it's just one great place for us to really filter through everything and keep things in one place instead of DMs.
And spark conversation with fellow hygienists, dentists, anybody.
That's been really nice.
Yeah.
Like seeing people have conversations about stuff.
Yeah, it's been great.
It's a good community.
Yeah. We really appreciate all the comments.
We do.
Questions.
Yeah.
Everything.
Thanks for joining us for another episode of Op Talk. Until next time, peace out, peeps.
Peace.
Bye.